Do you find yourself lying awake at night, unable to slip into the sweet embrace of slumber despite your body's cries for rest? Insomnia is a frustrating condition that plagues many individuals across the United States. What you might not be aware of is that some of the medications you're taking could be the cause of your sleepless nights. In this comprehensive video, we will take a closer look at the top 10 medications that have the potential to disrupt your sleep patterns. Let's unveil the medications that might be keeping you up at night. The risk of experiencing sleepless nights due to medication is a common concern for individuals who rely on pharmaceutical treatments to manage various health conditions. While medications can be highly effective in addressing specific health issues, they often come with potential side effects, and insomnia is one of the most frequently encountered. Let's take a look at medications that can cause insomnia. 10. Caffeine. Caffeine, the beloved stimulant found in coffee, tea, soft drinks, and even some over-the-counter medications, is a widely used tool to keep fatigue at bay. However, studies have shown that consuming caffeine even up to 6 hours before bedtime can significantly disrupt sleep patterns, contributing to insomnia. The recommended daily caffeine intake for most adults is around 400 milligrams, which is roughly equivalent to 4 cups of brewed coffee. To minimize its impact on sleep, it's advisable to consume caffeine-containing products earlier in the day and avoiding them in the hours leading up to bedtime. The side effects may include insomnia, nervousness, an elevated heart rate, and upset stomach. 9. Albuterol. Albuterol, a bronchodilator that uses airway muscle tension to facilitate breathing, is frequently prescribed to manage conditions like asthma and chronic obstructive pulmonary disease or COPD. Despite its effectiveness in treating these conditions, studies have revealed that albuterol usage, especially at higher doses, can lead to sleep disruptions. The typical adult dosage often involves taking 2 puffs every 4 to 6 hours. Though this may vary, patients should adhere to their specific prescription guidelines, considering the use of an inhaler spacer if recommended. To minimize the impact on sleep, it's advisable to use albuterol earlier in the day. Potential side effects include insomnia, nervousness, an elevated heart rate, headache, and dry mouth. 8. Pseudoephedrine. Pseudoephedrine is a decongestant frequently found in over-the-counter cold and allergy medications. It is employed to relieve nasal congestion and related symptoms. Research has shown that pseudoephedrine usage can lead to an increased heart rate, restlessness, and consequently sleep disruption. The typical adult dosage involves taking 60 milligrams every 4 to 6 hours, although variations may occur. Users should follow the product label or their healthcare provider's guidance. To minimize potential sleep disturbances, it's recommended to use early in the day and to avoid it close to bedtime. Possible side effects include insomnia, increased heart rate, restlessness, and dry mouth. 7. Prednisone. Prednisone, a corticosteroid utilized in treating various inflammatory conditions like allergies, asthma, and arthritis, can be a double-edged sword. While it effectively reduces inflammation and suppresses the immune system, studies have shown that it can disrupt sleep patterns and increase alertness, particularly when taken at higher doses. The typical adult dosage may vary widely depending on the condition and the patient, typically ranging from 5 milligrams to 60 milligrams per day. Patients should adhere to their prescribed regimen, possibly taking it with food to minimize stomach discomfort. It's generally taken once daily, although dosing may vary. Side effects of prednisone may include insomnia, increased appetite, mood changes, and weight gain. 6. Sertraline. Sertraline, an antidepressant falling under the selective serotonin reuptake inhibitor or SSRI category, is a vital tool in the management of depression, anxiety disorders, and related conditions. Clinical studies have indicated that sertraline usage may lead to sleep disturbances, particularly in the initial weeks of treatment. Typical adult dosages involve taking around 50 milligrams per day, which can be adjusted as needed. To minimize sleep disruption, patients are advised to follow their doctor's recommendations and maintain consistent usage. Sertraline is usually taken once daily and may yield side effects like insomnia, nausea, dry mouth, and sexual dysfunction. 5. Methylphenidate. Methylphenidate, a central nervous system stimulant, plays a pivotal role in managing attention deficit hyperactivity disorder or ADHD. It enhances focus and reduces impulsivity in individuals with ADHD. Studies have found that methylphenidate usage can result in sleep problems and a decrease in sleep duration. The typical adult dosage varies based on the formulation and individual requirements. To minimize sleep disturbances, it is recommended to take it as prescribed, typically in the morning. It is usually administered once daily as directed by the healthcare provider and can yield side effects such as insomnia, an increased heart rate, nervousness, and loss of appetite. Should you have any inquiries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to explore it. 4. Levothyroxine. Levothyroxine, a synthetic thyroid hormone used to treat hypothyroidism, is essential for restoring normal thyroid function in those with an underactive thyroid. Clinical studies have suggested that levothyroxine treatment can lead to sleep disturbances, particularly when the dosage is excessively high. The typical adult dosage varies depending on individual needs and blood test results. To minimize potential sleep disruption, it is recommended to take levothyroxine on an empty stomach at least 30 minutes before consuming any food, and to avoid taking it near bedtime. Possible side effects include insomnia, nervousness, weight loss, and palpitations. 3. Montelukast. Montelukast, a leukotriene receptor antagonist used to manage allergies and asthma, reduces airway inflammation and bronchoconstrictions. Studies have indicated that montelukast can lead to sleep disturbances in some individuals. The typical adult dosage usually involves taking 10 mg once daily in the evening. To mitigate the potential impact on sleep, it is advisable to take this medication in the evening. Side effects may include insomnia, mood changes, and headaches. 2. Amphetamine and dextroamphetamine. Amphetamine and dextroamphetamine, central nervous system stimulants, are widely employed in the treatment of ADHD. They enhance focus and reduce hyperactivity in individuals with ADHD. Clinical studies have reported that medications containing amphetamine and dextroamphetamine can result in sleep disturbances, especially when used later in the day. The typical adult dosage varies depending on the specific formulation and individual requirements. To minimize the impact on sleep, it is advisable to take these medications as prescribed, typically in the morning. It is usually administered once daily and may yield side effects such as insomnia, an increased heart rate, nervousness, and a loss of appetite. 1. Levodopa. Levodopa, a medication used to manage Parkinson's disease and dopamine-responsive dystonia, plays a crucial role in increasing dopamine levels in the brain and alleviating the symptoms of these conditions. Studies have shown that levodopa can lead to sleep disturbances, particularly when used at higher doses. The typical adult dosage varies based on the individual's condition and response to treatment. To minimize potential sleep disruption, it is recommended to adhere to the specific dosing schedule as directed by the healthcare provider. Levodopa can yield things like insomnia, nausea, vomiting, and involuntary movements. While medications play a pivotal role in managing various health conditions, it is crucial to be aware of their potential side effects, including insomnia. If you suspect that a medication you are taking is causing sleep disturbances, it is advisable to consult your healthcare provider. They can help explore alternative options, adjust your dosage, or provide strategies to manage insomnia while still benefiting from your treatment. Managing your health and sleep quality is a vital aspect of overall well-being, and an informed patient is better equipped to navigate these challenges effectively. Now, a quick question to you, our dear viewers. Have you ever experienced difficulty sleeping while taking medication? Let us know down below in the comments. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.